Hello students, you are welcome to Angel Health Academy. Topic for the day or topic for the session is factors influencing health. There are many factors which influence the health of a person or a human being. So in this video we will discuss about factors influencing health. In my last video I have discussed in detail about various dimensions of health. So we came to know at the end of that video our health is multi-dimensional. Health is multi-dimensional, or it has got number of elements and factors. That means health is influenced by a complex of various factors, a complex of interplay of various factors. These factors are connected or it influences our health. That is the meaning of a complex of a variety of a number of interplay or interrelated, interconnected various factors. So these factors shape an individual's overall health and well-being. So these factors, these complex factors which shape an individual's overall health and well-being, which either positively influence the health of the person or it negatively make an impact in the health and well-being of the persons. So our health is influenced by a complex interplay of various factors. These factors shape our overall health and well-being either positively or negatively. The major factors which influence the health or major factors influencing health include 8 major factors and some other factors. First factor is physical or biological factor, like physical dimension, physical or biological factor. Second is same like mental factors, like mental dimension, mental factors. Then as social dimension, social factors. Then environmental factors, healthcare system and policies. Next factor is healthcare system and policies related factors. Behavioral and lifestyle of the person, that is behavioral and lifestyle factors. Economic factors, our socio-economic background, that is economic factors. Then government and public health infrastructure or institutions. So government and public health infrastructure factors and other factors. So these are the major factors which influence the health and well-being of each and every individual. Physical factors or biological factor, mental factor, social factor, environmental factor, healthcare system and policies, behavioral and lifestyle factor, economic factors, government and public health infrastructure or health institutions or health sectors related factors and others. That is modern technology advancement all comes under other factors. So for the easy understanding and remembering of these factors influencing health, I have made a small mnemonic. This mnemonic also connected with the previous mnemonic because most of the factors, first 4 factors, it is connected with the previous physical dimension. So I made same mnemonic like PM said, Prime Minister said, then we start a mnemonic. Every healthcare staff, that is nurse and other staff, health worker, every healthcare staff behave or should behave as per the ethical principles. So nurses, we have many ethical principles as to followed when we work in the hospital setting or community settings. So every healthcare staff should behave as per the ethical principles in government and public health institution where they work. So government and public health institution include or such as government hospitals, district hospitals, community health center, primary health center, sub-center, health and wellness center, etc. So government and public health institutions and other areas like communities, outreach sessions, okay, then during healthcare camp, etc. So PM said every healthcare staff behave as per ethical principles in government and public health institution and other areas. So this is the mnemonic. So let us expand this mnemonic. P stands for physical or biological factor. M stands for mental factor. Z stands for social factor. Every stands for environmental factor. Healthcare staff stands for healthcare system and policy. Behave as per stands for behavioral and lifestyle factors. Ethical principles stands for economic factor. Government and private health institution stands for government and public health infrastructure. Other area stands for others. So in this way you can remember, if you really need, you can remember the factors influencing health. Now let us discuss one by one how this factor positively or negatively influence the health of the person or individual. First one is physical or biological factors. Physical or biological factors. Biological factor or physical factors are inherent factors. That factors are inherited from our parents. So children are inherited from their parents. That is inherent factors, hereditary factors. That individual are born with. So it is inborn at birth, okay, or which can also develop over time of development. So develop over time, and they significantly, importantly influence the health outcomes. So that is positive and negative health outcomes will be based on the biological or physical factors which are inherent factors from the parents to the children that may be seen at birth, or it can even develop after the birth during the developmental stage. The biological factors include genetics, age, gender, immune system function and hormonal factors. So there are 5 sub-factors of biological factors. They are genetics or genetical factor, age-related factor, gender or sex-related factor, immune system functions, our immunity or resistance power of the person and its normal function, and hormones. Hormonal influence, that is hormonal factors. Let us discuss about the sub-factors comes under biological factors. First one is genetic factors. So these are the hereditary factors inherited from the parents. So hereditary factors can predispose, it can influence individuals to certain diseases. So that means certain diseases that suffering by our parents may be transmitted to the children through genetic factor, through chromosomes and genes. So certain diseases such as heart diseases, almost all heart diseases, diabetes mellitus, hypertension, even some type of cancers and other genetic disorders. So there are many genetic disorders transmitted from parents to children. I have given a few examples like sickle cell anemia, cystic fibrosis, etc. So you can understand that there are many or various genetic disorders can be transmitted from parents to children. So this is about how genetical factor influence positively or negatively to the health of the human being. Next one is age factor. As individual age or as individuals age or get aged after 60, 70, 80, they become more prone to certain health issues such as arthritis, that is joint pain, osteoporosis, okay, bone related disorders, then cardiovascular diseases and even cognitive function decline, okay, reduction of cognitive or intelligent function. For example, dementia is a disorder which is seen in the old age people, okay, related to memory. So as individual get aged or age, they become more prone to, there are more chances to get certain health problems or issues such as arthritis, osteoporosis, cardiovascular diseases and cognitive decline or intelligent and memory related problems such as Alzheimer's, dementia, etc. Okay, and even some of the diseases are very specific to some age. Okay, for example, children are prone to have infectious diseases, and at the same time old age are prone to have cardiovascular and other disorders such as cancer, etc. Okay, so this is about how age influence the either positively or negatively to the health of the human being. Next is gender, sex of the person. Men and women have different risk of certain diseases. For example, women are prone to or more prone to have osteoporosis in the old age. Okay, while men are more likely to suffer from heart diseases at a younger age. Okay, all the men in younger age, they are risk for heart diseases, cardiovascular diseases. Okay. At the same time, whereas all the old age people, old age women are prone to have osteoporosis during the old age period. So this is how men and women have different risk factors for different diseases. That is the gender influence of the positive and negative health of the person. Next is immune system functions. As you know that we all protected from infectious diseases from our immune system. Okay, so a person's immune response, immune reaction or resistance play a key role in resisting number of infections come across during his life period. So a person's immune system play a key role, important function or role in resisting or preventing the number of infections. But the weakened immune system, if the immune system are very poor, okay, it is weakened due to some diseases such as HIV, human immunovirus, cancer, or even from malnutrition, okay, that increase the susceptibility, proneness, okay, susceptibility to have various infectious diseases. So the health of the person is directly influenced with his immune system, how it functions. If it is weakened, he may prone to number of infectious diseases. Next factor is hormonal factor. So we have a number of hormones. Okay. So hormonal change may occur in different period of the life. So hormonal change such as those during the puberty, during adolescent period. Okay. During the puberty, during pregnancy, okay, or during menopause. Menopause means at the age of ending the menstruation, that is menopause after 50, 45 to 50, can affect the health outcome, including reproductive health related problems, mood disorders, okay, psychiatric problems, and metabolic changes and even metabolic syndrome, etc. could be seen due to the hormonal changes which occur in the puberty, during pregnancy or antenatal period, and during menopause period. Okay, that all lead to reproductive health related problems, mood disorders, stress, okay, and even metabolic related problems and changes. The second major factor is mental health factors or psychological factors. So mental health is closely interconnected with physical health. Okay. So mental health and physical health is somehow it is interrelated or interconnected. And psychological factors can have a significant influence, important influence on our overall health and well-being. Okay. The sub-factors comes under mental health factors or psychological factors include mental health, emotional well-being and coping mechanism of a person. Mental health, emotional well-being and coping mechanism. First one is mental health. So promotion of mental health is very important. It positively influences the health of the human being. But there are many mental health conditions or mental illness such as depression, anxiety, stress. This all can affect our physical health by disturbing the sleep, disturbing our hunger or appetite, and disrupting the motivation for self-care. So mental health conditions or mental illness like depression, anxiety, stress, all will affect the physical health of the persons. Sometimes that make certain problem is called as psychosomatic disorders. This is caused by sleeping disturbances, hunger disturbances. Okay, we may have loss of appetite, there won't be any hunger for the person, and disrupting the motivation for self-care, etc. will negatively influence the mental health of the person. Thus promotion of mental health is very important to promote the health and well-being. Next is emotional well-being of a person. A positive outlook of the person or the resilience. Resilience is nothing but the balance of mental health and physical health and emotional health. That is positive outlook of a person or balance and emotional support. Okay, emotional health contribute to the better health outcomes or well-being of a person. While chronic stress, that is prolonged period of stress and tension, and negative emotions or anxiety, anger, etc. Negative emotions and emotional trauma all can lead to poor physical health or indirectly it affects the physical health of the persons. So emotional well-being contribute to the positive health. At the same time, negative emotions such as chronic stress and trauma, mental trauma, emotional trauma can lead to poor physical health of the person or individual. Third factor is sub-factor is coping mechanism. So how an individual or person cope with his stress. Okay, either the continuous stress or chronic stress or mental illness or life changes and problems, okay, that influence their positive health or optimum health. So the coping mechanism, the level of coping mechanism, how a person cope with or cope up with his day-to-day problems or life problems such as stress, illness and other continuous life changes influence their health positively. Okay, so if the person is following healthy coping mechanism, positive coping mechanism such as doing regular exercise, practicing meditation and having a number of social network support, all will promote the well-being and the health of the persons. While if you following unhealthy coping strategies such as depending upon the substance, that is substance abuse, and withdrawal from the social, like social isolation, okay, and depression, etc. can have a detrimental effects or a negative impact on the health of the persons. So coping mechanism and type of coping mechanism of a person, that is positive and negative approach to coping up with a different situation, will influence positively and negatively the health and well-being of the person. So this is about the 3 sub-factors of mental health or psychological factors. The third factor, major factor influence the health of the person is social factors. The social determinants or social factors are the conditions, various conditions in which the people or person are born or continuously growing or live or work setting and his age, changing ages. All the condition will becomes under social factors, and these factors have a significant or important influence of the health of the or positive health and well-being of the persons. Okay, so that conditions includes socio-economic status, SES, that is socio-economic status of the person, educational background or status of the person, social support system of the person, cultural practices and beliefs of the person, that is cultural beliefs and practices of the individual, and social discrimination or gender discrimination and inequality that is present in the society, all comes under 5 sub-factors of social factors. Let us discuss in short about the 5 different sub-factors of social factors which influence the health of the person. First one is socio-economic status. So how socio-economic status influence the health of the person, we were discussed in the last video and when we talk about the social dimension. Okay, so the same thing only here we are going to discuss that individual or person with low income, that is whoever comes under BPL, below poverty line. Okay, the person who have no education or less education and no good occupation, that indirectly he may lead to poor socio-economic status, then that may cause limited access to the health care. He cannot access a multi-specialty hospital for sophisticated health care. He cannot have the nutritious food for his family and for himself, and he cannot live the safe living environment with all housing standards because of his lower income. That indirectly influence the health and well-being of the persons. So person with a low income, lack of education and poor occupation will negatively affect the health and well-being of the person, as there is a limited access or limited availability of the healthcare services, nutritious food or balanced diet and safe living condition or environment. Second factor is the same factor, that is education. So higher level of education are associated with better health literacy. So a person may have more knowledge about the healthcare services and he may follow the healthier lifestyle choices, or he may select the healthier or positive lifestyle choices, and he may have of course improved access to the healthcare services available even in the private sector. Okay, and moreover educated individuals are more likely to understand, okay, and to know about the importance of the all the preventive health measures, and they avail all the preventive health measures available in their states and country. That is how education influence the, or education status of a person influence the health positively and negatively. The next one is social support. So strong social network or social support if a person is having, that includes family support, number of good intimate friends, then good community or society participation. All this provide emotional support to the particular person, that directly or indirectly reduce his stresses or her stresses, and it also contribute to the healthy practices and healthy behavior or healthy habit formation. At the same time, lack of social support can lead to social isolation, social separation, social loneliness, and even that lead to depression, and that may lead to increased vulnerability, the chances to have a different type of diseases or illness. He may prone to get a number of illnesses. So lack of social support can lead to social isolation, depression, and increased vulnerability to various illness and diseases. Thus, strong social network is very important to promote the health and well-being of the persons. The fourth sub-factor is cultural belief and practices of the person. Cultural beliefs and practices of the human being. The cultural norms and various traditions can directly influence the healthy behavior of the person, such as preferring the healthy diet, exercise program, and seeking the healthcare practices, that is healthcare seeking practices as early or by late, etc. Okay, so the cultural practice and traditional practices of the person can influence his behavioral, okay, positive or negative behavioral or healthy or unhealthy practices related to diet preference, exercise and seeking healthcare services, okay, from the government sector, private sector as early possible or with a late period. And moreover, in some of the cultural practices, people are follow traditional medicines, okay. They prefer more importance to traditional medicines that may not be scientifically proved, but they may not follow the modern healthcare even in the emergency situations, which can delay the treatment pattern to certain conditions that may lead to complication in their life, okay. As cultural practices and beliefs, a few people or group may follow the traditional medicines regularly than the modern healthcare practice or than depending upon the modern healthcare advanced treatment. This negatively influences the health of the person. The next one is discrimination and inequality. So of course in our society there is a discrimination and inequality with the marginalized group of people. Okay, marginalized group means people may be discriminated due to the race, due to the gender, due to their caste or due to the religion. Okay, people may be discriminated in the society as marginalized group. Okay, those people may experience health disparities, less health services due to unequal services to the healthcare. Okay, they may not be able to achieve the quality healthcare services. At the same time, they may have higher exposure, increased chances of exposure to various stress. Maybe that is directly from that stress related to discrimination, stress related to inequality, related to caste, gender, etc. Okay, and they may have even poor living condition, that also may be higher chances for stress. These all indirectly influence the health of the person who belongs to marginalized groups. Okay, so the discrimination and inequality is the another factor in the social factor that may negatively influence the health of the individual and the human being. And as you know that gender discrimination is very significant and very common in all the states of the nation. So the fourth major factor is environmental factors. The fourth major factor is environmental factors. So the immediate surrounding of a person or individual, okay, where he lives in the society or community or workplace, and even in the place the person used to play, all indirectly impact their health. Okay, so environmental factors include physical environment, climate and weather, living condition of the individual or the person, and workplace related hazards, work setting hazards. Okay, the sub factors of environmental factors include physical environment, climate and weather changes, living condition and situation of the person, and workplace hazards and problems. First one is physical environment. Access to clean water or availability of the clean water and good air, that is air quality, good sanitation, okay, and safe housing standards all are critical to maintain and promote the positive health in individual. Okay, so the provision of clean water, air, sanitation facility and safe housing standards all are critical and important to maintain the health of the persons. Then polluted environment, okay, if the place is polluted, that polluted environment can lead to number of respiratory illnesses, diseases such as breathing difficulty, asthma, then waterborne diseases such as cholera, etc. Okay, and these all indirectly or directly increase the risk of infections. Thus, physical environment of the person is very important to promote his health and well-being. Next is climate and weather changes. So extreme weather events or weather conditions, okay, increased heat, increased cold, etc. may lead to floods, okay, heat waves and even droughts. These all can affect the food chain and food pattern and food security of for those particular people who are under floods and heat waves or droughts. That all lead to spread of various vector-borne diseases. Vector-borne diseases are nothing but a disease is transmitted by different vectors such as mosquitoes, flies, etc. Okay, and of course it increases the risk of injuries and even death. Thus, climate change plays an important role in altering the disease pattern. As you know that in summer season people have different outbreak of diseases, and even in rainy season or other cold season people may have exposed to different other problems. So both the climate change and weather change will directly influence the health of the individual or human being. The third factor is living condition of the particular person or individual. That means overcrowding, poor housing and lack of basic facilities or amenities to the people all will directly contribute to the spread of infectious diseases and poor mental health of that particular group of people. Okay, those who are living in the overcrowding area, those who are not following the standard of housing, that may lead to poor housing, and those who may not have adequate facilities, basic facilities and necessities and amenities, all will directly influence the health of the person. That may influence or contribute to the spread of various infectious diseases or communicable diseases, and moreover they may have a poor mental health. All this situation may lead to negative outcome in the health and well-being of the person. That is regarding living condition. Then workplace hazard, work setting hazard. So exposure to harmful chemical substances or repetitive task with missions that may cause frictions, injuries, etc. or unsafe work environment. Okay, that all can cause to occupational diseases or occupational illness. Okay, example, lung diseases such as pneumoconiosis, that is a respiratory diseases due to dust allergy. Okay, pneumoconiosis. Even handling with the missions, etc. may lead to musculoskeletal disorders and injuries. So these all indirectly or negatively affect the health of the person or well-being of the person. So that is comes under workplace hazards or work settings hazards. So this is about how environmental factors influence the health and well-being of the individual or the human being or person. Next major factor is behavioral and lifestyle factors. So how behavior and lifestyle of the person influence the health and well-being. The lifestyle choices, selection of different lifestyle of a person's or daily activities or daily behavior or habit of the particular individual have a major impact on his health and well-being. Okay. The sub-factors comes under behavioral and lifestyle factors are diet and nutrition, physical activity, substance abuse, sleep pattern, stress management and personal hygiene. So these are the 6 sub-factors comes under behavioral and lifestyle factors which directly or indirectly influence the health of the person. First one is diet and nutrition. So a balanced diet rich in fruits, vegetables and grains, whole grain, okay, that is cereals, okay, whole grains and even proteins, lean proteins, vegetable proteins, all support the overall health of the people. Okay, if the person is following the balanced diet, it of course positively affect the health of the person, that reduce the number of infectious diseases. Okay, while the person follow poor nutrition or unbalanced diet, that can lead to obesity, malnutrition, diabetes mellitus, even cardiovascular diseases. So of course the diet and nutrition have a direct impact on the health of the person. So how he prefer the diet, okay, daily diet. So if he consume a balanced diet with rich fruits, vegetables, grains and proteins, etc., of course that promote the health and well-being. Or if there is a lack of nutrition in his daily living, or if he consume more diet, that may lead to obesity, malnutrition, diabetes mellitus, metabolic disorders and even cardiovascular diseases. The second sub-factor is physical activity. Under physical activity, regular exercise promote the physical and mental well-being of the persons. So if the person is follow regular exercise, daily exercise for 30 minutes, it promotes both his physical and mental well-being, and also it reduces the risk for many chronic diseases, okay, such as heart diseases, diabetes mellitus, certain cancers, etc. So physical activity, regular physical exercise will promote the physical and both physical and mental well-being of the person. The third sub-factor is substance use, substance abuse, such as smoking, excessive alcohol consumption and different drug use or substance use. All are risk factors for diseases such as lung cancer, liver diseases, cardiovascular diseases and moreover mental health issues. So substance use or substance abuse may act as the risk factors for many diseases such as cancer of the lungs, liver diseases such as cirrhosis of liver and even cardiovascular diseases, hypertension, heart attack, etc. and other mental health issues and of course social problems. That is about the substance abuse, how it will influence the physical health and well-being of the person. Next is the sleep pattern. Fourth subfactor is sleep patterns of the person. Adequate sleep for minimum 8 hours is essential for maintaining the both physical and mental health of any individual or human being. Sleep deprivation, that is lack of sleep less than 6 hours, okay, is linked to or is connected to the problem with the obesity, increased body weight and body mass, diabetes mellitus, cardiovascular diseases, and even mental health problems such as anxiety, depression, etc. Okay. So adequate sleep is very important to promote the health and protect the health. At the same time, lack of sleep or sleep deprivation can lead to number of diseases such as obesity, increased body weight, diabetes mellitus, cardiovascular diseases, and even in mental health problems such as anxiety, stress, depression, etc. And moreover, it affects the total daily activities of the person. Okay. Then next is stress management. So, of course, in life we face in the different type of chronic and acute stress, okay, during different situations. If the stress is continued for a prolonged period, that means chronic stresses, okay, chronic stress can reduces the resistance power or weaken the immune system. That indirectly increase the risk of heart diseases, and even it is contribute to various mental health disorders, anxiety, depression, etc. Okay, so chronic stress can weaken our immune system or resistance power of the body or reaction towards the infection, that may increase the risk for heart diseases and even for the mental health problems such as anxiety, depression, suicide, etc. Okay. And we already discussed about the coping of the stress. So how individual manage his stress or cope up with stress also very important to promote the health of the persons. For example, through mindfulness, for example of coping, that is through mindfulness, by exercise, regular exercise. Then if unhealthy coping strategies like if the person is dependent upon the substance abuse, alcoholism, etc., smoking, etc., that affect the overall well-being of the person negatively, that may lead to number of diseases. So coping mechanism or how individual manage the stress positively or negatively, that also influence the health of the person positively and negatively. Then next factor is the personal hygiene, maintaining the personal hygiene of the person. Practicing good personal hygiene such as regular hand washing, dental care, then safe food handling practices, okay, safety on handling the food. All this helps to prevent the spread of various infectious diseases. So maintaining the personal hygiene is very important, or practicing good personal hygiene is very important to prevent the number of infectious diseases, okay, viral infectious diseases and other bacterial infectious diseases. So that is all about the behavior and the lifestyle factors of the individual, how it influences the health positively and negatively. The fifth major factor is economic factor, okay, economic condition of the person. So we already discussed the socio-economic status of the person, how it influences the health both positively and negatively. So economic condition at both the individual and the nation, okay, the country influence the access of the healthcare services, that is availability of the healthcare services. As India is developing country, we cannot provide health services in all the remote areas of our country, okay, that reduces the access to the healthcare to the rural people, okay. And nutrition, supply of nutrition also depends upon the economic condition of the particular individual and the particular nation or country. Then overall living condition and the facilities provided to the people in the environment also depends upon the individual economic status and our country's economic statuses. Thus, economic condition at both of the individual person and the national level or national level influence the access to healthcare, access to nutrition and overall living condition and well-being of the person. So the economic factors includes income and poverty, then employment and job security of the person, and healthcare access to the public or citizen of the country. So income and poverty, employment and job security, and healthcare access. First one is income and poverty. So individual living in poverty state are more likely to experience poor healthcare services due to limited access to the nutritious food or balanced diet, due to limited availability of the healthcare services, and due to limited availability of the safe drinking water or clean water and safe housing standards and safe housing environment. So people who are in BPL, below poverty line or under poverty, they may have a limited access or lack of nutritious food, healthcare services and clean water, safe water and safe housing standards and environment. Thus, financial insecurity can also cause the chronic stress among the people, which has a negative effects or which may lead to both mental and physical problems. Thus, financial insecurity may lead to chronic stresses and health problems, both physical and mental health problems among the individual. The second factor is employment and job security. Okay, safety in the job. So stable employment, so continuous employment and permanent employment, that is stable employment provides financial support or financial resources or income to the person that helps to access the available healthcare services, access the balanced diet or nutritious food and have the safe housing conditions. So on the other hand, both unemployment and unstable jobs, okay, so person not having a permanent job can lead to the continuous or chronic stress that may lead to anxiety, and that may indirectly or directly reduce the access to the essential or basic healthcare services and basic necessity of the normal living. Okay, so both employment and job security also influence the health and well-being of the person. Then third one is healthcare access to the public or access to the people. That is availability and affordability. Affordability means the person can receive the services by paying a particular amount, that is affordable. Okay, so government services, if you go to the government hospital, you can get the admission and you can get the services by paying a minimum amount with the ration card, okay, or Aadhaar card. Okay, that is affordability. So affordability of healthcare services are crucial for preventing and treating all the diseases. Okay, so access of healthcare is very important to prevent the number of diseases and get adequate treatment for a particular problem. But in case of low income, that may not be available, that may not be affordable for the people. Okay, thus healthcare cost can be significant barrier, because at present the healthcare cost is very high. So that is a significant barrier to receive the timely care and the care at the right time. Okay, so lack of access of timely care may lead to the poorer health outcomes in the people, those who are having less socio-economic status. The sixth major factor is healthcare system and national health policies, various health policies in the state or the country. Healthcare system of the country and national health policies. The structure and functioning of the healthcare system or healthcare delivery services in the state and country and various health related policies in place have a direct impact or influence on the individual and population or citizens' health. Okay, so every country is having their own healthcare delivery services at central level, state level and district level, and various health policies, okay, to be rendered health services comprehensively and qualitative in nature to the public or citizen. Okay, so we will be discussing in detail about the healthcare system in the second unit of the foundation topic. I have already uploaded a video of health system central level, state level, district level. If you really interested in that to know more about the topic, you can go through that. Thus, the structure and functioning of healthcare delivery services in the country, that is health system or healthcare system of the country, and the health related policies have a direct impact on the individual health and population health or citizens health. Okay, the sub factors under healthcare system and policies include access to healthcare. Okay, then health insurance coverage to the public or citizen, then preventive health services, that is rendered by the government healthcare system or healthcare services, and various health policies, national health policies and other health policies, education policy, population policy, health policy, etc. Okay, first one is access to healthcare. Access to healthcare or availability of healthcare services to the public. The availability of healthcare services, especially in the rural area or for the underserved areas, that means undeveloped areas, remote areas, affect the health outcomes of the people who are living in the remote or rural area where access to healthcare services are very minimum or less. Thus, limited access to primary care or primary health care services, availability of the specialist doctors or surgeons, or availability of the emergency services all can delay the diagnosis of the people in the underserved area or remote area, underdeveloped area or rural area, and their treatment also will be affected, thus their health and well-being also indirectly affected. So access of healthcare services or availability of healthcare services are very important point for the promoting and preventing various diseases in the people who are residing in the rural and remote or underserved areas. Actually, healthcare services is depend upon the budget of the country and the availability of the health facilities in the country. The second sub-factor is health insurance coverage, health insurance for the public. So having health insurance to the people allow the individual to access all the healthcare services without facing significant financial difficulty or hardship. So those who are having less economic status, if they have a government health insurance scheme or if they have covered or under the government health insurance coverage, then they won't have much expense during the secondary healthcare services in the hospitalization when they got admitted with the different problems. So in 2018, Government of India introduced the Ayushman Bharat Yojana health insurance coverage for the family, that is 5 lakh rupees coverage for the family. Okay, so that is the government health insurance. So lack of coverage often leads to delayed care. So those who are not comes under that Ayushman Bharat coverage or other government health insurance coverage, they get delayed. Okay, they get late healthcare services because of the socio-economic condition, and they also may be missed with the preventive health care that is given by the government to the public, and of course that all led into later the poor management for the even chronic diseases or chronic condition of the people, those who are not covered under health insurance. So that means health insurance coverage also influence the health of the people. Okay, so those who are not under the government health insurance coverage, they may not get the adequate services, preventive services and treatment for the chronic conditions and other conditions, because government insurance gives health services at complete free of cost, that is 5 lakh rupees coverage for each family. Next is preventive health care services. So there are many preventive health care services that is rendered by the government health services to the public. That is availability of the vaccination. You know that immunization is the preventive health services to prevent the vaccine preventable diseases in the public. Okay. Then there are many screening tests to early detection of the diseases. Okay. Even cancer screening, there is breast cancer screening test, etc. like that. And health education and health awareness programs, outreach sessions of the government, all helps in early detection of the diseases, early finding out of the diseases and complete treatment, even prevention of diseases with immunization. Okay. So the availability of vaccination, screening and health education program helps in early detection of the diseases and prevention of those diseases. So the country with the strong public health initiatives or programs, they tend to have better health services or health outcomes for its citizens. Okay. So those countries which provide more preventive health services or they have more initiatives or health programs, of course India has got many health initiatives and programs for the well-being of the citizen of the country. Okay, that would tend to have better health outcomes or better health and well-being for its citizen. Thus, preventive health services of the government or public also influence the health of its citizen or people. Fourth one is health policies. So there are many health policies or health act to protect the people and public. For example, government health related policies on public health, health related policies on environmental protection, policies on food safety, policies on health care, okay, policies on budget of the health care, that is health care funding, all play a vital role or important key role in determining the overall health of the population. So overall health of the population or citizen of the country depends upon the government policies on various policies such as policies on public health, policies on environmental protection, policies on food safety, and policies on health care funding, etc. Okay, so different health policies in the country or state also influence the health of the people. That is about the government health infrastructure and policies, how it influences the health of the people in the country. Then eighth major factor is government and public health infrastructure. Of course, government is providing various health infrastructure or health institution to render the health services for the public or citizens, such as medical college, district hospital, community health centers, primary health centers, sub-centers, health and wellness centers, family welfare centers, etc. Like that, government has many clinics and health centers to render the health services at free of cost to the public. The sub-factors include public health initiatives, various public health related programs, that is called initiatives, government programs at free of cost. Then health education and promotion, IEC activities, information, education, communication activities from the government side to promote the health of the people and to protect the people from various illness, and emergency management or response from the government side that we could have seen during the COVID-19 pandemic or outbreak of corona. Okay, so the first sub-factor is public health initiatives or programs. So effective public health programs or initiatives, government health related programs such as vaccination campaigns, sanitation program, that is sanitation improvement program. For example, you know that a dry day, government is celebrating once in a week a dry day to prevent the vector-borne diseases or insect-borne diseases. Okay, and disease surveillance is nothing but conducting the survey or epidemiological survey to early detection of the outbreak or epidemic of any diseases. All can significantly reduce the burden of the infectious diseases. Okay, so public health initiatives or government health-related programs all will influence positively to promote the health and well-being of its public. Okay. Next is health education and promotion programs. So health education session, IEC, information education communication session, all the government, other promoting health services. So all public awareness campaigns. So government conducted various campaign or camp for the public awareness on healthy living or campaign on disease prevention and campaign on identifying the risk factors and controlling or treating the particular problem in advance. All can empower the individuals to promote the or to empower the health of the individuals to take control of themselves. So they themselves take control of their health and it make informed decisions. So people in advance know about their problem and they will get the solutions by various health awareness programs and they take logical decisions, health related decision with their own participation. Okay, thus health education and promotion activities, IEC activities promote the health of the people in the country. Okay. The last one is emergency response. So government that can respond quickly on health emergencies such as any pandemic, any outbreak like Nipah outbreak, okay, any natural disasters, all can mitigate the impact of the such a crisis and that promote the health of the population. That is emergency response from the government side also promote the health of the people. So the ninth factors is others. Okay, ninth one is others. That is advanced science and technology in the medical field and other areas. That is advanced science and technology. So advanced science and technology have both positive and negative impacts. Under positive impact, it increases the standard of living of the people. Okay, and it increases the quality of life of the people. That has been an aspect of reducing number of diseases and health related problems. As the standard of living is increased, the quality of life of increased because of the advanced science and technology. At the same time, the negative impact of the advanced science and technology are stress and tensions. So day-to-day life, people have more tension and more stresses to cope up with the different problems and issues. And stress and tension even that led into the addictions or substance abuses. Then ultimately the negative impact of the advanced technology and science have led into number of cancers, death, etc. So the advanced science and technology's negative impact increased the stress, tension, addictions, different type of cancers and even number of deaths. This is about the factors influencing the health in that other factor, that is advanced science and technology. So let us summarize the topic. Today we have discussed about the number of factors influencing health. Major 9 factors. Under physical or biological factor, we have discussed genetics, age, gender, immune system function and hormonal factors and its influence. Second, under mental factor, we have discussed mental health, emotional well-being and coping mechanism of the individual. Under social factors, we have discussed socio-economic status, education, social support system, cultural beliefs and discrimination and inequality. Then under fourth factor, environmental factors, we have discussed or sub-factors are physical environment, climate and weather changes, living conditions of the people and workplace hazards. Fifth one is behavioral factors. Under that, diet and nutrition, physical activity, substance use or abuse, sleeping pattern of the person, stress management, the base of stress management and importance given to personal hygiene, etc. we have discussed as a sub-factors for behavioral factors. In the sixth factor, economic factors. So income and poverty, employment and job security, healthcare access to the public. Seventh major factor is healthcare system and policies. It includes access to healthcare, availability of healthcare to the people, especially in the rural people, health insurance coverage by the government to the public, and preventive health services of the government and various national health policies and health related policies. Then eighth factor is government and public health infrastructure or institutions or health settings. That is public health initiatives or programs, health education IEC or outreach sessions and emergency response by the government during any outbreak or natural calamities. The ninth factor include advanced science and technologies influencing health and well-being of a person. So you can use this table as the major factors and sub-factors. You may not remember all those things, but you write at least 2 or 3 important sub-factors of each major factors. Now let's conclude the topic. Health is influenced by a number of biological, environmental, social, economic, behavioral and other factors. All these factors are interrelated or connected. Okay. Thus they interact in the complex or different ways that shape the individual and community health and well-being or total health outcomes of the community or society. A person should follow the holistic approach to promote all these factors such as living conditions, access to health care and promoting healthy behaviors and healthy practices by the people to promote the health and well-being. So far we have discussed in detail about the major factors influencing the health and various sub-factors. Hope this video really benefits in your studies and exam. If you feel it is really worth and beneficial, please like, share and subscribe my channel. And so stay tuned with the Angel Health Academy for the next coming continuous educational video of Nursing Foundation Unit 1. And once again, thank you so much for watching my video. An important thing is don't forget to subscribe and like and comment my channel. Thank you.